This is Series 1, Pandemic, Public Health, and Structural Inequality. The core question we ask ourselves in Series 1 is, what did COVID-19 reveal about who's protected and who is expendable in global health systems? The abstract in Series 1 is, this series examines how the pandemic exposed longstanding inequities in health, labor, and policy. Each essay traces how race, class, and geography shape vulnerability. From frontline workers in overcrowded housing to medical mistrust and systemic neglect, it also explores resilience through community-led responses, the ongoing impact of long COVID, and the intersection of holistic and institutional care. Together, these essays argue that public health is inseparable from justice and collective responsibilities. This is Article 2, COVID-19's lasting global footprint. Modern-day effects, COVID-19 5 years later, by Jessica Vasquez-Luna. 5 years after the first lockdowns, the language of post-pandemic life feels more aspirational than accurate. COVID-19 may no longer dominate breaking news banners, but its imprint is everywhere, especially in communities that entered the pandemic already carrying the weight of structural inequality. What we are living through now is not an aftermath, it is an extended phase of a crisis that reshaped institutions, labor, and trust. One of the clearest long-term shifts is in the workforce. Illness, disability, and chronic symptoms have pushed many people out of unemployment entirely. The U.S. Bureau of Labor Statistics continues to record elevated numbers of individuals classified as not in the labor force due to illness or disability, a category that grew noticeably in the years following 2020. U.S. Bureau of Labor Statistics 2023. Economist David Cutler estimates that long COVID alone has imposed substantial economic costs by reducing labor supply and increasing disability claims. Cutler, 2022. These patterns reveal that the labor market is absorbing a public health crisis, not simply a set of individual choices. Healthcare workers, once publicly celebrated, are navigating a system stretched thin. Burnout was already a concern in early 2020, but research published in JAMA documented how fear, trauma, and sustained pressure intensified anxiety among medical professionals. Schoenfeld et al., 2020. Many left the field altogether, and those who remain are working in environments where staffing shortages have become routine. A system that was fragile before the pandemic is now operating with even less capacity to respond to future emergencies. Public trust in institutions has also shifted. Early in the pandemic, many people looked to scientists and health agencies for guidance. That trust has eroded. Pew Research Center found a continued decline in confidence in scientists and in the broader scientific enterprise by 2023, with the steepest drops among groups that already had reasons to distrust institutions. Pew Research Center 2023. For communities with long histories of medical neglect or discrimination, this skepticism is not new, it is reinforced. The pandemic simply made the fractures visible to those who had never experienced them. Globally, the picture is even more uneven. The World Health Organization's strategy to achieve widespread vaccination by mid-2022 highlighted the stark divide between high-income countries and the rest of the world. World Health Organization 2022. Delayed access to vaccines and treatments meant prolonged outbreaks, preventable deaths, and setbacks in other areas of public health. Interruptions to routine immunization programs and education systems will shape outcomes for years, especially in regions already facing resource constraints. The social and emotional consequences are harder to quantify but equally significant. Early data from the CDC's Morbidity and Mortality Weekly Report showed alarming spikes in anxiety, depression, and suicidal ideation during the first months of the pandemic. Seisler, et al., 2020. Those trends did not simply disappear. For young people, caregivers, and families who lost loved ones, the emotional landscape of the pandemic continues to shape daily life. These are not short-term disruptions. They are generational shifts in mental health and stability. Still, the past 5 years have revealed important truths. Community-based networks often responded faster and more effectively than formal institutions. Public health infrastructure, when funded, trusted, and accessible, proved essential. But the idea of returning to normal has become increasingly hollow. Normal was a system that left too many people unprotected. COVID-19 continues to shape the world we inhabit. The question is now whether we treat this as a moment of warning, turning point, or allow the inequities exposed by the pandemic to deepen. The crisis made clear who was shielded and who was left vulnerable. What we do now will determine whether those lines harden or finally begin to shift. The works cited in Article 2 of Series 1 are Cutler, David M., The Economic Cost of Long COVID, and Update, Harvard Kennedy School, Mosavar Rahmani, Center for Business and Government, 2022. Schoenfeld-Treit et al., Understanding and Addressing Sources of Anxiety Among Healthcare Professionals During the COVID-19 Pandemic, JAMA. Pew Research Center, Americans Trust in Scientists. Positive views of science continue to decline. Pew Research Center, 29 March 2023. World Health Organization Strategy to Achieve Global COVID-19 Vaccination by Mid-2022. WHO, 2022. U.S. Bureau of Labor Statistics Current Population Survey, Not in the Labor Force, Illness or Disability. U.S. Department of Labor, 2023. And Seisler, Mark E. et al. Mental Health, Substance Use, and Suicidal Ideation During the COVID-19 Pandemic. United States, June 24 to 30th, 2020. MMWR, Morbidity and Mortality Weekly Report. Now we will be going into the author's cut, where we discuss inspiration, purpose, and ideas regarding this piece. So this piece is titled COVID-19's Lasting Global Effects. And I think 5 years later, you would think that we would be so far ahead of this, right? Of course, in scientific terms, that's not that much time, but considering that the US was able to develop a vaccine in record time, you think that there would be a lot more research in terms of the lasting effects of COVID-19. Because, like I said in the essay, this is not something that's over. And it's not just affecting patients, but it's also affecting the healthcare workers who were pushed into these incredibly stressful and difficult professional positions. And I also briefly mentioned that public trust in institutions has also shifted. And I think the pandemic and the way that it was handled in early 2020, many people, obviously, we're all looking to scientists. We're all looking to, everyone was on the TV watching Dr. Fauci talk about this. But the Pew Research Center did prove that that trust has broken. And I think for underserved communities, the trust there has always been broken because, speaking for myself, I was told as a long COVID patient that there was not enough research to help me in my care. So I think so many people have tried to navigate the system in the US and been met with responses like that. So the trust is dwindling. And I think after the way that people were treated in the pandemic, it's just completely gone. And for immigrants and underserved communities who already have a lack of access into healthcare and already feel unsafe going to doctors, I think it's incredibly dangerous for these systems to lose their public trust, because at the end of the day, like, people do need medicine and care needs where they need help. And I think the fact that institutions are not willing to help them, whether it be in terms of research, in terms of insurance and cost, it's just incredibly disappointing where so many people come here and are able to create opportunities and are met with a lack of care when they do need help medically. Like I mentioned in this essay, what we do now is going to determine whether the lines harden or finally begin to shift in the healthcare system. So I really think treating the moment of the pandemic like as a turning point is going to allow us to really just like look at the causes and the inequalities, right? Because they were really exposed during the pandemic. And it's an arduous process, and it's never going to be an easy process to begin to shift a system that has historically ignored so many people. But seeing the impact that the pandemic did have on everyone really means that the system just left too many people unprotected. So it's time to start figuring out solutions and seeing how everyone can be shielded and not leave so many people vulnerable to another attack from a virus. So this piece really spoke to me, not just like in a personal way, but also in a professional light, because it makes me feel like I want to create opportunities for myself and for others to have access to healthcare systems that are built for them, made for them, and work for them. And I think it might be a naive take to think that, but reformation is possible. And so many workers and patients are yearning for that. The resources are there, and it's really time to just unite and not rely on the systems in place that aren't exactly helping people at the moment. And I think it's a very significant moment now that we are more than 5 years after the pandemic. We're at a point now where it's time to start looking at these long-standing effects and really get to the bottom of the public health systems in place. Because when more people are healthy and able to seek care and able to feel trust in the systems that are there to help them, they're also able to contribute to the economy. So this essay also commented on how there was a big loss in the workforce, and there still is a huge loss in the workforce. So being able to get these people access to care and able to get them back on their feet and able to create stability in the general public will also lift the economy and create more jobs and create more opportunity and just be kind of a win-win for everyone. Thank you for listening and thinking with me. I appreciate you being here, and I'll see you in the next article.